We are Pro Cannabis Media.
Hi, everyone. Welcome again to another live edition of LinkedIn with Jimmy Young on In the Weeds. And this week, we're so happy to have Dr. Ryan Zaklin with us. Dr. Zaklin is one of the most prestigious cannabis doctors in the Massachusetts area, certified for offering cannabis cards, medical cards to patients. I admit in a open forum that I am a medical card carrying member of the Massachusetts community. Dr. Zaklin is my doctor, and I so appreciate you joining us here today, Dr. Z.
Thank you so much, Jimmy. Always a pleasure.
Now, what's the latest in medication and cannabis? When you get right down to it, there's so many new researches that's out there. There's all sorts of movement at the federal level looking to ease some of the restrictions on research on cannabis. What's some of the more interesting research that you are privy to that you've learned recently about the world of cannabis, THC, and all those magical cannabinoids?
Yeah, it's a good question. I think the research conundrum, it remains to be a very interesting one. I know that, for example, over at McLean Hospital, Stacy Gruber has some really interesting research, and the projects the studies that they do. What happens is that you have the researchers here, right, and then they send the patients off. I believe they certify them and they say, go use medical cannabis and then come back and report back to us.
Right. You
and I and a lot of people know that this is like I don't even know. It's like Never Neverland. I mean, what's going on here is anybody's guess, right? It's all over the map. I mean, you're talking about go use medical cannabis. You're talking about smoking, eating it, suppositories, right? I mean, you're talking about dosages from anywhere from 0.5 milligram to 200 milligrams. And so to me, when I hear the research and I hear about these studies, I mean, she's actually done some remarkable research in which you mentioned medications. She's looked at some of these patients and she's noted, wow, they've cut their medications in half, as much as in half with some of them. She's looked at brain MRI images and then she's noted changes, right? So there are ways we have to look at it, but unfortunately, a lot of the research that we're looking at and that we have is they just looked at these patients use medical cannabis, right? There's research that looks at, there's an increased risk of cardiovascular events, of myocardial infarction, and how they do that is they look at patients that present to an ER, and they stratify and they see who is using cannabis. It goes back to this, right? It seems to be that there's this divide where there's the cannabis industry users, patients, right? The medicine makers, growers, right? And then there's this whole other side of it, which is I straddle both. And so, which I'll get to in a moment, but I think that what has to be done is there has to be a gap that's bridged.
Yeah.
And from my experience, I actually we ended up not getting the grant, but worked with some of the folks over at MG through Harvard Medical School. And we were going to use a kind of multi-strain developed product developed specifically for them. So like covered on this side, titrated to symptom control on this side. And then the researchers could kind of do their thing on that side. So the short of it is, look, there's a certain research train that's going, right? And the cannabis piece doesn't fit into it quite well. It's not like one molecule, one receptor. So what I think has to happen is, right, there has to be a bridge. And I don't know, I guess that's TBD, right?
Right. Well, I think what I'm hearing is some frustration from a medical professional. You'd like to see research in a controlled study where everything is controlled. And because of the variance in how many milligrams each person's taking, what age they're at, are they taking it on a full stomach, not on a full stomach? How are they taking it? More control of a study makes more sense from a research perspective. Is that what I'm hearing?
I think so. I mean, I think that it's also trying to, again, put cannabis into the same category as medications. Yes, it would be great to understand absorption on a deeper level. It would be great to understand, I think kind of dose curves and whatnot on a greater level. But here's when I give my talks, I always say, I mean, where the rubber hits the road, it's like, what about the fact that my patients had these amazing, capsules from one dispensary, and then, oh, we don't make that anymore because we got bought out by whoever, Big Canna, and right. I mean, like, we haven't even got research. I'm like, man, I gotta get medicine, consistent, high quality medicine for my patients.
Right.
We haven't even gotten there yet.
Right. Did you see the documentary on PBS that Stacy was featured in called The Cannabis Question by any chance?
I haven't, but I'd like to.
Oh my God, you've got to check it out. It's on YouTube. It was on Nova. It's magnificent. It tells the story of Sean Worsley. It goes into Stacy's studies. And one of the issues that I have with the community, and I'll share it with you, is, for years, the substance abuse community has been studying cannabis, right? Over 30,000 studies of cannabis over, let's say a period of a few decades. Okay. So if the substance abuse community keeps looking and looking and looking and never finding anything that, well, or when they do find it, it's minuscule compared to the benefits. And once again, the benefits seem to outweigh the risks when it comes to the benefits of this plant. But if that substance abuse community continues to dictate where the research money goes, what's the point of the research now if they're going to have access to states, legal states like Massachusetts that are growing the cannabis, and now there's a movement towards getting access to doing research on this legal cannabis that's in this state, and they're not getting the right kind of questions or the right kind of studies are happening. So I'm a little concerned about that. From your perspective, how would you like to see the substance abuse community changing how they look at this medicine?
Yeah, that's a great question. I mean, I think I'd like to see the substance abuse community, and I know I'm not a counselor, I'm not as familiar with it, I'm not a psychiatrist, but I do work with a lot of patients that use a lot of different substances, and to me, substance abuse is right. It's a behavior that's a sign of something underlying, right? I don't think anybody said there's always a story. They had dental work, and then they got addicted to oxycodone and and opioids, and then it spiraled downhill, or they had childhood trauma and didn't have the resources, right? I would say that the substance abuse folks need to pony up the mental health resources that the entire, if we're looking just our country needs, especially in light of the pandemic. It's been pretty much debunked that cannabis, it is a gateway drug. It's a gateway off of medications. Cannabis, I think that the way that it's viewed has to just change. And, my practice is Mass General Brigham affiliated, and we're really trying to, knock on the door and melt this wall of ice. And I think there are just deep cultural roots, right? Cannabis is a medical, legal, socio-economic. I mean, it's like biological, botanical, multifaceted phenomenon, right? So the reach of the roots of its culture are deep. And I think that the substance abuse community needs to reevaluate the way they see cannabis. And I think ultimately, there's maybe a light at the end of the tunnel. There was one study where they looked at opioid abusers, and they gave them CBD, it was like 800 milligrams a day for like 6 days or something like that, and it minimized their cravings or whatnot. So maybe that's a crack in the vase, but I think they need to start looking at cannabis as a useful tool. And one last thing is, my take, honestly, if I have a patient who can't stop drinking vodka all day long, or they've been shooting up heroin or taking massive doses of Oxycontin, and now they're smoking pot all day, every day, that's a win and a half. You know what I mean? It's like they're alive and they're engaged, and it's not, they're not sitting there on the couch drooling. Right. They're functioning and they feel better.
Yeah.
So that's my quick take.
Right. And look, in my 360 odd interviews that I've done over the last few years, I can't tell you how many times I've heard cannabis has saved my life. Cannabis has changed my life. And again, if you use the product properly, and you work with a physician like yourself, someone who has an idea of what the entourage effect is, what the endocannabinoid system is in all mammals, and how it affects us all differently, you can talk to them and listen to them and work with them on their titration and their plan on usage. And I think that's how it needs to go. During the pandemic, and you mentioned this, have you seen an increase in the amount of patients you're seeing looking for medical cards?
Oh my god, it was yes. Well, the pandemic was interesting because there was a series of events. It was the perfect storm for us. We started taking insurance in March of 2020.
Good timing.
And then the Cannabis Control Commission approved for telehealth visits.
Right.
And then they shut down adult use. And it was like we were on Neta's site. We got like 30 calls in one day. But then we realized that people were just the anxiety, depression. It was all through the roof. I mean, one way that I look at cannabis is I like recreational. I don't like adult use. It's like that conjures up other images. It doesn't make sense, right? So like recreational seems to make more sense, and it's recreational. You're recreating an experience in a way. You're shifting. You're creating enhancing a musical experience, a sexual experience, a social experience. And then there's medical, right? So medicinal use. So somebody comes to me and they look and they want their insomnia treated, right? I'm looking to treat their insomnia. Now, anything other than treating insomnia is a side effect. Intoxication is the most typical side effect, right? So now if you like intoxication, if you like the side effect, my attitude is, well, good for you. I'm happy for you. If you don't like it, well, then we have to work very hard to make sure that you're not uncomfortable, right? But if you fall into that category of like, I use it medicinally and I like it, which I call therapeutic, I don't, it's, to me, my patients have to report back to me their level of function, and I have to diagnose it and assess it. But I tell them, I say, you know what, to be honest, I say the intoxicating side effect, I mean, it's a side effect of your medication, right? If a medication gives you diarrhea, that's kind of like only your business and your doctor's business if you're sharing it, right? I'm like, so if it's a side effect of your medication that you feel kind of euphoric and a little bit, fuzzy and relaxed, and you like that, that's honestly your business. It's nobody else's business.
Interesting.
As long as you can function, right? I mean, if you can't function and you're not like you're not able to, you're zoned out, and or you're, obviously you can't drive while you're doing it, although, right? But it's like all things considered, it's at night, you taking your gummy, and like if you feel good and you like it when you're sitting there watching your, Netflix show, that's great. I'm happy for them.
Yeah, absolutely. And CBN is a little magical cannabinoid that seems to be the magical one to help people with their sleep issues. Are you seeing more people come to you for sleep issues than any other diagnosis? I don't know if you could share that info.
It's a top, I would say it is probably a top three. Yep. CBN is a byproduct, degradational byproduct of THC and CBD. It is more sedating. I mean, I have some patients that come and they rave about it. To be honest, like, great. Can I get it for my patient? It's like, I'm not going to start them on something. Rev Clinics has their CBN. Sleep has some, but then it's not everywhere, right? So now they get the CBN product and they get it from the dispensary, and they can't get it, or they can only get it in one dispensary. So again, it's like, there's a real, when the rubber hits the road. I just had a patient yesterday who was talking about these gummies that they got in, I think, California or Colorado. They brought back, and they're like, they have these great CBN gummies. Of course, I said, that's federally illegal, and if you do that again, I cannot be your physician. But they, they were some CBN ones. But my point is, she brought them from California, right? It was like, it's great in theory, and down the road, maybe we'll be popping CBN pills to help us sleep through the night. But right now, it's just not accessible.
Right. And I think that continues to be one of the frustrations. When you were talking a little bit about the word adult use, recreational, those are the terms that regulators have put in place to differentiate the different types licenses and access to the plant medicine that is cannabis. So it serves that purpose. But from a medical standpoint, it's frustrating because there are medicinal benefits to this plant, whether you get it at an adult use recreational dispensary or you have a medical card and you go in, correct?
Yeah, that's a great point, Joe. I love you always make you always bring you always present a point that drives something home that kind of like makes me think about things differently. And it's a great point that really is, it's a licensure designation. You know, it's an interesting analogy, right? And but it's kind of veer off. So like the sativa indica designation, right?
Yeah.
It's really a phenotypical designation, the way that the plant actually looks, right? It's not a chemovar equivalent, but yet people are trying to throw away the terminology. I like it. I think I understand it, right? It's like sativa that has a certain strain, has a certain energy, higher energy, hybrid, indica, right? But it's not how it was really intended, and it has caused some mass confusion. I think that when you use the licensure designation, yeah, it's because what you're saying is there's over-the-counter medicine, which is what we know with medicine.
Right.
But yet for that one, you have to pay 20%, sales tax, and it's still limited.
Right.
It's very confusing, and not to mention it perpetuates the stigma, which is what I find myself mainly doing, removing. Right. We went out to Arizona. It was interesting. I was out in Arizona for vacation. Of course, I had to, get my medicine in the dispensary, but my medical card wasn't good there, but they had recreational. And it's like, you're like a second-class citizen over there, which is interesting. The recreational patients, it's just like a different, I don't know. So it's like there's these different pockets and these different subcultures that are starting to emerge. And a lot of it is politically driven.
Right. Well, God, let's not get into politics, please. Because it's a dynamic I just can't handle right now at this point. But let me ask you a question, and I don't want to go much longer here because I know you're a busy guy and I know you have lots of patients lined up. What's the process? I know we're in Massachusetts, and Massachusetts, like every state that has a legal program, has a process that you go through when it comes to applying for medical card. Are people still, I'm not sure I want a medical card, but I'm willing to go to the adult. Are they at least accepting the fact that, having a medical professional as someone I can go to talk to about the interaction, not just with my cannabis, but with my Western medicine, the various prescription drugs, the ones that the doctors, the Western medicine doctors, not that you're not a Western medicine doctor, you did go to med school and all that, but you know what I'm saying, the PCPs of the world, that conflict between the two. Do a lot of those questions come up when you talk to your new patients?
I mean, so most importantly, the way that I see my relationship with cannabis, right? It's a medication that I use, just like an oncologist specializes, they know how to use chemotherapy, right?
Yep.
Not a great analogy, but they're not, people don't call them chemo docs. They don't, right? I'm not really a cannabis doc. I just have I understand cannabis therapeutics is a very sophisticated art. Right. And I understand that art, right? And I also understand medicine, so I can use it. Now, that being said, I tell my patients, I could care less about the stupid card. It's the dumbest, all it is a tax break and an entrance, a ticket into other specific products, which are higher in dosage, which actually probably should be low to have more available for microdosing, right? So it's analogous to going to your physician and they say, all right, it looks like you have an infection. When do I use some antibiotics? But first you got to go see this other doctor, pay them, $250, and they'll give you a card that says you can go to CVS and go get antibiotics. Right. It makes zero sense. So that has to be eliminated. The one thing I'll say that's a little cockamamie is, like, my patients, some of them will say, invariably patients come to me for advice for how to use it, right? I get referrals from my physician colleagues. Most people don't come to me for the card. And if they do, they've looked at our website. They said, wow, you really do more than just this. This is why I wanted to come see you. But I had a patient recently who they have a license to carry a gun. That's a whole other, and you cannot have a license to carry and a medical card in Massachusetts. Now, you can go get a friggin' liter of whiskey and down that, go to the dispensary, go get 10 joints and go out and fire away, right? But
if you have a medical card, you can't.
If you have a medical card and you're going and you're getting your like 10 milligrams of, twice a day, no, you're not fit to hold, So for those kind of like obscure reasons, and then, on occasion, people that are a little anxious, but by and large, I think that the medical card, what I feel it offers is for people that aren't comfortable necessarily with work, with their job, their employer, right? It just kind, and I think it does in a way. It's really a certification, but they think of it as a license,
right?
And so I think it does make the relationship a little more official too, at least in my practice.
Gotcha.
But yeah, I mean, I think that people, it'll be interesting to see what happens with the cards, because I can't wait till those cert mails are just out of business. I just think it's a part of the problem.
Interesting. Integrative medicine is what you practice, correct? And that's how you describe it. That's what you do best. And it is something, I tell you, I always enjoy our conversations, both privately and in public like this too, Dr. Zaklin. How do people find you up in the Salem, Massachusetts area?
Oh, thanks, Jimmy. They can go to our website. It is ecswellness.com, ecswellness.com, or call the office, 978-998-0010.
And I got to tell you, your support staff does a great job handling you and handling patients like me.
Exactly. I think it's mostly me, and then everybody else gets the. Well, listen, Jimmy, it's really nice to see you. Hey, wishing you and yours a happy, healthy Thanksgiving. To your fans as well, thank you for the opportunity to speak. I always enjoy our conversations.
There you go. And as we like to say, as we sign off all of our podcasts and our weekly Weed Talk News and our Green Rush Live, it's a whole new world of weed out there, people. Use it responsibly. I'm Jimmy Young from Pro Cannabis Media. Thanks for watching another edition of LinkedIn Live on In the Weeds with Jimmy Young.
Weed Talk and In the Weeds are two productions of Pro Cannabis Media supported by Revolutionary Clinics, one of the top medical cannabis dispensaries in the Massachusetts area, now with 3 locations in Greater Boston, 2 in Cambridge and 1 on Broadway in Somerville. Rev Clinics has a patient-first mission. They will customize your needs as a medical patient with the proper titration and combination of strains, flavors, and products. Rev Clinics, where the patient comes first.
Difference is building a solution for that individual, not just a custom, here's a box, here's a video, here's how you make your VMS. We custom design and custom build every situation for exactly what the customer needs. And we keep the cost low. We have multiple tiers, as far as what you're looking at on the cost side of things. If you want a one-time, where you just pay one initial cost, we have that. If you want to maintain your system and have the highest protection and highest capabilities and highest upgrades at all times, we have different plans for you. But we scale it so it's scalable and affordable 100%.
Pro Cannabis Media programming is available live and on demand on our Facebook page at Pro Canna Media, on Instagram at Pro Cannabis Media, on LinkedIn also at Pro Cannabis Media, on YouTube and YouTube Live on Pro Cannabis Media, Twitter at Pro Canna Media, and on twitch.tv/Pro Cannabis Media. So like, share, and subscribe to all of our content, newsletters, and shows live or on demand.
We are Pro Cannabis Media.